Hi, this is Dr. Aidoo. I'm with the Department of Anatomy and Cell Biology, School of Medical Sciences, University of Cape Coast. I bring to you the lungs of a human being. We want to look at the gross anatomical features of it. So this is actually the left lung. So for the left lung, it is characterized by just one fissure known as the oblique fissure, which will divide the lung into a superior portion and then an inferior portion. The superior portion is known as the superior lobe, the inferior portion, the inferior lobe, and that is the inferior border. Then at the top there, which looks like the top of a pyramid, is the apex. When we look at the anteromedial portion, you find this anterior border and then the lingula, which looks like the tongue, so lingula. And then you also see the extension of the oblique fissure all the way. When we take a look at the medial view, we also see the lingula there, and then also portions of the oblique fissure is showing there. And more importantly, the hilum here, where most of the structures enter and leave the lung. So we try and go accordingly and look at these structures. So you have here the superior pulmonary vein, and then you also have the inferior pulmonary vein. Because we are dealing with the left lung, we call that the left superior pulmonary vein and then left inferior pulmonary vein. Then you can also see this large hollow structure here. That is the pulmonary artery. Then you have the left main bronchi there. So the left main bronchi will divide into the left lobar bronchi, okay? Two of them, and one will enter each lobe. So one will enter the superior lobe and the other will enter the inferior lobe. And then the lobar bronchi will continue to divide into segmental bronchi. You find something creamy-like here. Okay, a portion of it is still showing there. That is the pulmonary ligament. It is actually a reflection of the parietal pleura, which is actually coming from the somatopleuric portion of the lateral plate mesoderm. All right, the splanchnopleuris forms the visceral pleura. So this is the parietal pleura, a reflection of it, known as the pulmonary ligament. Then a careful look at the inferior portion here will reveal an impression. So that is the diaphragmatic surface. So the diaphragm fills this portion. Then here too, you see another depression known as the cardiac impression. So the heart also bulges into this area. Then you have a notch here known as the cardiac notch. It is not too revealed because of this reflection of the anterior border of the lung there, so it is masking it, but it's supposed to be around this area where the heart also makes a notch. Then again, you can see, if you observe critically, there's an impression here that is laid by the descending aorta, and the medial to that is that of the impression created by the esophagus. As you move superiorly, that impression created by the esophagus will lead upwards, okay, as also impression of the esophagus, and then the trachea as well. Then there is a curving pattern of impression also created here by the arch of the aorta. Most of the impressions are not too obvious in this structure, but then you also have the brachiocephalic trunk, impression created there as well. So basically, this is what I want to bring to your attention today. I hope this video helps. Thank you very much.